intraventricular septum. When I come to the front, what's this one sitting on the front of it? If this is posterior intraventricular, what's this one?
Anterior.
Anterior intraventricular. What's the one that goes around the circumference of the heart? Circumflex artery. You got the little blue one going across the front of the heart. The one going around the back. Little blue one going across the front of the heart. What is it? Front of the heart. Anterior cardiac vein. No. Look, remember this one. See the small one underneath the marginal artery? Right? Small one under the marginal artery is small cardiac vein. One going down the middle of the back of the heart. What do I call all veins? Cardiac. It's the middle cardiac vein. All right, look. Great big blue one goes up and around. Great cardiac vein. Right here where it balloons up. That's the coronary sinus. All the veins were cardiac until I get here. Then it becomes coronary sinus. Where does it drain into? Where does all blood drain into? The right atrium. That coronary sinus drains right into the right atrium. Okay? What was this? Layers from the inside out, Brand.
Okay, what means inside and what
If
means
it's
like
inside, right, no cardiac. Next one is muscle.
Which one are you pointing at?
Generic name.
Which one are you pointing at?
This is the right AV. What's this?
Left AV.
Now, this is the tricuspid. What's this?
Bicuspid.
Give me the third name for this.
The Pope thing.
Remember, it looks like the disconnect with the lighter. This is the mitral valve. MITRAL.
C.
In order. Big blue one.
Superior vena cava. Aorta. Pulmonary trunk. Pulmonary arteries. Left and right pulmonary artery.
Artery. Comes back through the left and right. So, when we do the electrical system, I start right here. Where am I? SA node. Then it goes to AB node. Then it goes to AB bundle. What's the line going down on the right side?
The right.
Right? Bundle branch. And then it goes to the little bitty fibers. What are they? Pachy fibers.
Can you spell that?
Okay, so wait.
Mr. Candia.
SA node, AB node, AB bundle. Then the right and left bundle branches, and then the Purkinje fiber.
Can you spell the name for the fibers?
The Purkinje.
Capital Purkinje.
AV bundle, right and
Spell it
left
right,
branches.
too.
Right and left bundle branches.
Bundle.
You deserve it.
Because you went to the AV bundle, and it's branching out of there, so it's a bundle branch. All right, what's this white, what's this stretchy round thing?
I just put fetus.
Ligamentum arteriosum.
What does that have to do with?
Okay, remember the blood's gonna come to the right atrium. 85% is gonna go through the pyramidal valley straight over to the left atrium. That other 15% drops into the right ventricle. I don't need it to go to the lungs. So when it comes out here, it squirts up into the aorta and goes out.
Oh, okay. I just put something about fetus.
Ligamentum.
That's all I could remember.
Ligamentum arteriosum. Now,
It does.
easy way to remember, if it's open, it's a duct, D-U-C-T. So, the ligamentum arteriosum, when it's in the fetus, is the ductus arteriosus. The foramen ovale, when it closes, becomes the fossa ovalis. Got it? And when do they close? Who's born?
After the.
What does the baby do?
Takes its first breath and
Takes
goes
its
like,
first
oh
breath.
my gosh.
When it goes, it's like, oh, she kicked me out.
Same.
Those valves start closing, okay? Now, when the baby comes out, sometimes it's facing down, sometimes it's facing to the side. And what it does is it flips over on its back. Kind of does a backstroke getting out. Okay? It's got to take that first breath. When that baby comes out, we look at it. That's your first test. In your whole life, that's the first test you have to pass. Because when you come out,
Disappointing my parents.
we
from the
need to
start.
see if you're breathing. We need to listen to your cry. We need to look at your movement. Okay? And we grade you on it. And if it's high enough and you're a viable baby, you're going to make it. If it's down to the ones or you're missing some, it means we got a lot of work to do, because let's say you're not breathing. Then we have to start giving you oxygen. We have to start giving you, put you on a respirator. If your cry is real weak, it indicates poor breathing. Were the lungs open or closed when that baby was born? Before it came out, open or closed?
Closed.
Closed. Why?
It's got to, well, I assume because it takes its first breath, I'm assuming that it flows into it, or air into it, and it expands the lungs.
Because where does the baby get its oxygen?
The umbilical
From
cord.
mama.
Mama.
Okay? All right. Look at your paper. And if you see those lines, it tells you you got a lot of work to do between now and Friday. Understand, some of you know by looking that you got a Christmas present with that grade. Christmas does not come in May. So you need to make sure you keep your grades up. So what you're going to do now is on this one, this is the one I'm going to use for the papillary muscle. Okay? Mackenzie, what's the papillary muscle do? Ask somebody in your group.
The valve so
Closes the valve.
No.
No.
But
Just kidding. I
no,
was
but close.
joking.
Okay, look. The valve is doing this.
Oh, it keeps it from doing the.
it keeps it from going inside out.
Yeah.
Keeps it from turning inside out.
That's it.
Okay? Keeps it from turning inside out.
I was.
The signal's going to go down to the Purkinje fibers, and it cuts across the moderator band in the right atrium and goes straight to the anterior papillary muscle and says, get ready, hold on, we're going to contract. That tells all the other papillary muscles, hold on. Because I want it to close, but I want it to stop here. In the left atrium, it is under a lot of pressure. Very easily can turn inside out. if you know that this one, the left one, is called the bicuspid valve or the mitral valve. And I tell you that when a valve turns inside out, it's called prolapse. All right? I've got the left valve turning inside out. What do I call it? I call it a prolapse mitral valve or a prolapse bicuspid valve. Got it? So, the chordae tendineae tears in the left atrium, in the left ventricle. What's going to happen? What else? It's going to go up into the atrium. Okay? So, I'm going to hear it when the heart squeezes. So what it creates a systolic murmur. If I go to the right side and the tricuspid tears, I'm going to hear it. I'm going to hear a diastolic murmur. When the heart rests, I'm going to hear it flapping. Okay? Next question. Why is your blood red? Listen to me. In middle school, in elementary school, in biology classes, and in college, some biology classes, we're still fighting with the professors. They teach that. They teach that your blood is red because of oxygen. That is absolutely incorrect. White blood cells have oxygen, and they're not red. Close. Write it down.
Color doesn't exist.
Your blood is red because of the presence of hemoglobin. Hemoglobin is in the red blood cell. That's what makes the red blood cell red. That's what makes your blood red. If you look at your arms and you see those blue veins, understand, you don't have any blue blood. Your blood is either bright red because it's got a lot of oxygen being carried on the hemoglobin, or it's dark red. We never really get rid of all the oxygen. So it's one of those, which came first. Your blood is red because of hemoglobin. Hemoglobin carries oxygen. If your oxygen drops, you get cyanotic, you turn blue. At the same time, if you lose red blood cells, you lose hemoglobin, you get cyanotic, you lose oxygen. So, but if you see the question that says, what makes your blood red? The answer is hemoglobin. When we did the muscles, we talked about what makes red muscles different than white muscles. It doesn't have hemoglobin. What it has is the molecule myoglobin. Myoglobin makes red meat. When it doesn't have myoglobin, it makes white meat. Look at a chicken. The thighs and the legs are dark meat. Okay? It's got a lot of